From a dull ache in your chest that feels like indigestion, to sudden jaw pain that you chalk up to sleeping weird, to exhaustion so extreme you can barely stand. These are the symptoms killing 18 million people every single year. That's one person dead from a heart attack every 40 seconds. And the worst part? Most victims ignore the warning signs until it's way too late. Because what's actually happening inside your body during those first 48 hours is a biological nightmare most doctors don't fully explain. Your heart cells are dying by the billions. Your organs are starving for oxygen. And every minute you wait, your chances of survival drop like a rock. So buckle up, because we're about to dive into the terrifying reality of what really happens in the first 48 hours of a heart attack. And trust me, after hearing this, you'll never ignore chest pain again. At 6:47 a.m. on a random Tuesday, Dave's sitting in his kitchen eating toast and scrolling through emails. Just another boring morning. But inside his chest, a tiny piece of plaque in his left coronary artery just ruptured. And he has no idea he's already dying. Because here's what's happening. That plaque, a buildup of cholesterol and inflammatory cells that's been growing for years, just cracked open like a broken water pipe. Dave's body immediately panics and sends platelets rushing to the site to patch the damage. But instead of fixing the problem, they form a blood clot. And within minutes, that clot completely blocks the artery. No blood flow means no oxygen. And the heart muscle downstream of that blockage? It's officially starving. Dave feels a slight pressure in his chest, kinda uncomfortable. He figures it's heartburn from the coffee and keeps scrolling. Classic mistake. Because what he doesn't know is that his heart cells are already switching to anaerobic metabolism, burning fuel without oxygen, like a car engine running on fumes. It's inefficient, painful, and unsustainable. But here's the real kicker. Studies show that about 30% of heart attacks present with atypical symptoms, especially in women. Instead of the classic crushing chest pain you see in movies, victims report vague discomfort, nausea, or extreme fatigue, so they ignore it. They pop an antacid, they sit down for a minute, they convince themselves it's nothing. Dave does exactly that. He takes a couple Tums and heads to his car for work. Meanwhile, the clock is ticking. Medical experts call the first 60 minutes after symptom onset the golden hour. If you get treatment during this window, your chances of survival skyrocket and permanent damage stays minimal. But if you wait, every minute that passes, more heart muscle dies. The infarct, that's the medical term for dead tissue, grows larger. The damage becomes irreversible. And Dave's burning through his golden hour while stuck in traffic, still thinking he just ate breakfast too fast. Because that's the thing about heart attacks. They don't announce themselves with sirens and flashing lights. They whisper. They hint. They give you just enough doubt to second-guess yourself. And by the time you realize something's actually wrong, the damage is already done. So while Dave's worried about making it to his 9 a.m. meeting, his body's fighting a war it's losing. His heart's pumping harder to compensate for the blocked artery, which only increases oxygen demand in tissue that's already suffocating. It's like asking a drowning man to swim faster. The pressure in his chest intensifies. His left arm starts to ache. He's sweating even though the AC is blasting. But Dave keeps driving. Because he's got deadlines. Because he doesn't want to overreact. Because admitting something might be seriously wrong is terrifying, so denial feels safer. And that denial? It's about to cost him everything. 30 minutes later, Dave's parked in his office garage and the pain has gotten worse. Way worse. The pressure in his chest now feels like someone's sitting on him. His jaw aches, his left arm is numb, and he's drenched in sweat like he just ran a marathon. But you know what he does? He sits there and tries to rationalize it. Maybe he pulled a muscle moving boxes yesterday. Maybe it's stress from that project deadline. Maybe he's just getting old and out of shape. Yeah, because pulled muscles make you vomit in your car, which is exactly what happens next. His coworker Jenny walks by and notices him through the window, looking pale and hunched over. She knocks on the glass. Dave waves her off, mouthing, "I'm fine." But Jenny's not buying it. She opens his door and immediately says what everyone around heart attack victims eventually says. "You look terrible. We need to get you to a hospital." And here's where it gets frustrating. Because the average time from symptom onset to calling 911 is between 2 to 3 hours. 2 to 3 hours. That's not a typo. People sit around, hoping it'll pass, convinced they're overreacting, worried about wasting everyone's time or looking stupid. But here's what they don't realize. Every 30 minutes of delay increases your risk of death by about 7.5%. So, if you wait an hour, you've just increased your mortality risk by 15%. Wait 2 hours? You're up to 30%. These aren't small numbers. These are the difference between walking out of the hospital in a few days versus not walking out at all. And it gets even worse for certain groups. Women, on average, wait longer than men to seek help. Why? Because their symptoms are more likely to be atypical. Instead of dramatic chest pain, they might just feel exhausted, nauseous, or short of breath. And when they do go to the ER, they're more likely to be dismissed by doctors who assume they're anxious or overreacting. The result? Higher mortality rates for women, especially younger women under 55. The same pattern shows up with racial disparities. Black and Hispanic patients often wait longer and receive slower treatment even when they do get to the hospital. Systemic bias kills people. Not dramatically, not obviously, but steadily and statistically. Back to Dave. Jenny's not taking no for an answer. She pulls out her phone and calls 911 while Dave weakly protests. "I don't want to make a scene," he mumbles. "It's probably nothing. Nothing. The guy's having a heart attack and he's worried about making a scene." The 911 operator asks questions. Chest pain? Yes. Radiating to the arm? Yes. Shortness of breath? Yes. She tells Jenny an ambulance is on the way and to keep Dave calm and seated. Do not let him drive himself. Do not let him walk around. Because here's the thing. Physical exertion during a heart attack can trigger cardiac arrest. Dave's heart is already struggling. Making it work harder by walking or driving could be the thing that tips him over the edge, from really bad situation to dead before the ambulance arrives. So, by the time the paramedics roll up, it's been an hour since Dave first felt that pressure. An hour of his golden window, gone. An hour of heart muscle dying while he sat in denial. And inside his chest, the damage is already catastrophic. While the paramedics are racing to the scene, sirens blaring, here's what's happening at the cellular level inside Dave's chest. And trust me, it's an absolute horror show. Remember that blocked artery? The one starving Dave's heart muscle of oxygen? Well, those cells downstream are now in full panic mode. Under normal conditions, heart cells use oxygen to burn glucose and produce energy through a process called aerobic metabolism. It's efficient, clean, and sustainable. But without oxygen, those cells switch to plan B, anaerobic metabolism. They start breaking down glucose without oxygen, which produces way less energy and creates lactic acid as a waste product. It's like trying to run a factory with half the power and no way to remove the trash. The cells are suffocating in their own waste. And here's where things get really dark. After about 20 to 30 minutes of zero oxygen, heart cells start dying. Not slowly, not gracefully. They rupture. The cell membrane breaks down, the internal structure collapses, and all the cell's contents spill out into the surrounding tissue like a burst water balloon. Each dead cell releases enzymes and proteins into the bloodstream. The main ones doctors look for are troponin and creatine, kinase MB, or CKMB for short. These are cardiac markers that confirm you're having a heart attack. But here's the catch. They don't show up in detectable levels in your blood for several hours. So by the time a blood test can confirm the damage, billions of cells are already dead. Let's put this in perspective. A healthy human heart contains roughly 2 to 3 billion cardiac muscle cells. During a moderate heart attack, you might lose 1 billion cells in the first few hours. That's about a third of your heart's workforce, gone forever. Because unlike skin cells or liver cells, heart cells don't regenerate. Once they're dead, they're replaced by scar tissue that can't contract or help pump blood. But it's not just the cells in the immediate blockage zone that are dying. There's this weird middle ground around the infarct called the border zone, where cells are stunned or hibernating. They're not getting enough oxygen to function normally, but they're not quite dead either. They're in this zombie state, and whether they survive depends entirely on how fast blood flow gets restored. This is why every single minute matters. For every minute that artery stays blocked, more cells cross from stunned and salvageable to dead and gone forever. The infarct grows outward from the blockage site like a spreading fire. consuming tissue as it goes. Doctors measure this in square centimeters of dead heart muscle. A small heart attack might destroy 1 to 2 square centimeters. A massive one can wipe out 10 to 15 square centimeters or more. And the bigger the infarct, the worse your odds of survival, and the greater your risk of complications. Meanwhile, those dying cells are also releasing inflammatory signals that attract white blood cells to the area. Your immune system is trying to clean up the mess, but in the process, it causes even more swelling and damage to the surrounding tissue. It's friendly fire on a cellular level. And remember, this is just the heart. Because as the pump weakens and cardiac output drops, every other organ in Dave's body is about to feel it. As if a dying heart wasn't enough, here's where the body's domino effect kicks in. Because when your heart can't pump efficiently, every organ downstream starts to suffer. Dave's cardiac output, the amount of blood his heart pumps per minute, has dropped by about 30 to 40%. That means his brain is getting less oxygen, his kidneys are getting less blood. His liver, his lungs, his muscles, everything is running on reduced fuel, and his body knows it. First, his brain starts to fog. Confusion sets in. Dave's having trouble focusing on what the paramedics are saying. His vision's a little blurry. Some heart attack victims pass out entirely at this point because their brain simply isn't getting enough oxygen to maintain consciousness. His kidneys respond by going into conservation mode. They reduce urine output and start retaining fluid, which is the body's attempt to maintain blood pressure. But this creates a vicious cycle because now there's more fluid in the system that the weakened heart has to pump. It's like asking a failing engine to tow a heavier load. Meanwhile, Dave's body dumps stress hormones into his bloodstream. Adrenaline, cortisol, and norepinephrine flood his system, triggering his sympathetic nervous system, the fight or flight response. His heart rate spikes, even though his heart's already struggling. His blood vessels constrict, trying to maintain blood pressure. But this just makes the heart work harder to push blood through narrower pipes. It's a biological disaster feedback loop. Finally, the ambulance arrives. The paramedics rush over with their equipment and immediately start their protocol. First thing, they give Dave aspirin to chew, which helps prevent the blood clot from getting bigger. Then nitroglycerin under the tongue to dilate his blood vessels and reduce the heart's workload. They slap an oxygen mask on his face and start an IV line. One paramedic's doing a 12-lead ECG, attaching electrodes to Dave's chest to measure his heart's electrical activity. The readout shows ST segment elevation, which is doctor speak for, "This guy's definitely having a massive heart attack." They load Dave into the ambulance and radio ahead to the hospital. 2-year-old male, STEMI in progress. ETA, 8 minutes. STEMI stands for ST elevation, myocardial infarction, the most serious type of heart attack. Now the race is really on. Because there's this thing called door-to-balloon time, which is the medical industry's gold standard. From the moment a heart attack patient arrives at the hospital to the moment doctors open the blocked artery, the goal is 90 minutes or less. Studies show that meeting this target dramatically improves survival rates and reduces permanent damage. But even with professionals involved, even with sirens and urgency, and everyone doing their jobs perfectly, Dave's still bleeding time. It's been over an hour since his symptoms started. His golden hour is long gone. At the hospital, the cardiac team is already prepping the cath lab. They're going to do an emergency angioplasty, a procedure where they thread a thin catheter through an artery in Dave's groin or wrist, guide it up to his heart, and inflate a tiny balloon inside the blocked coronary artery to push the clot aside. Then they'll place a stent, a small metal mesh tube, to keep the artery open. If Dave's lucky, they'll restore blood flow before too much heart muscle dies. If he's not, well, the damage is already done, and he's about to find out just how permanent really is. Because here's where things get really dark. Whether you survive the next 24 hours depends entirely on whether you're in that golden window, and most people aren't. So here's the brutal math of heart attacks. If you get treatment in the first hour, your survival rate is over 90%, and permanent damage stays relatively minimal. Maybe you lose 5 to 10% of your heart function. You recover, you go home, you live a mostly normal life. But if you wait 3 hours or more, now you're looking at 40 to 60% of your heart muscle potentially dead. Your survival rate drops to somewhere between 60 and 70%. And if you do survive, you're facing serious, permanent disability. The difference between acting immediately and waiting just a few hours is the difference between a close call and a life sentence. Dave's getting his procedure at about the 90-minute mark from symptom onset. Not great, but not the worst case either. The cardiologist threads the catheter up through his femoral artery, navigates it to his heart, and locates the blockage in his left anterior descending artery. They inflate the balloon, crushing the clot against the artery wall, and deploy a stent to keep everything open. Blood flow restored. Heart attack stopped. Crisis averted, right? Not even close. Because here's what nobody tells you about heart attacks. Even when you stop the blockage, even when you restore blood flow, the complications are just getting started. First up, ventricular fibrillation, or VFib for short. This is when your heart's electrical system goes completely haywire, and instead of beating in a coordinated rhythm, the ventricles just quiver uselessly. No blood gets pumped. You've got maybe 4 to 6 minutes before brain damage starts and 10 minutes before you're dead. About 10 to 15% of heart attack patients develop VFib, usually in the first 24 hours. Treatment? Immediate defibrillation. They literally shock your heart back into rhythm. If that doesn't work, you're getting CPR and drug therapy. If that doesn't work, well, there is no that doesn't work. You just die. Then there's cardiogenic shock, which is when your heart is so damaged it can't pump enough blood to keep your organs functioning. Your blood pressure crashes, your kidneys shut down, your brain doesn't get enough oxygen. Mortality rate? About 50%, even with treatment. Half the people who go into cardiogenic shock don't make it out. And if you thought that was bad, there's also the risk of cardiac rupture. This is rare, happening in only about 1 to 2% of cases. But when it happens, it's catastrophic. The weakened heart wall literally tears open. Blood floods into the pericardial sac around the heart. Pressure builds. The heart can't fill with blood. You go into cardiac tamponade, and you've got minutes to live unless a surgeon can crack open your chest and repair the rupture. Most ruptures happen 3 to 5 days after the initial heart attack, when the dead tissue is at its weakest. But let's talk about the most common killer in the first 48 hours, sudden cardiac arrest. This is different from a heart attack, but heart attacks trigger them constantly. Your heart just stops, no warning, no gradual decline. 1 second, you're conscious. The next, you're on the floor. Here's the terrifying statistic. About 50% of all heart attack deaths happen in the first hour after symptoms start. Half. Most of those are sudden cardiac arrests that happen before the person even gets to a hospital. And even if you make it to the hospital, even if you get the procedure, you're not safe. Modern medicine can do incredible things, but there's a catch. Not everyone gets that care equally. If you live in a rural area more than an hour from a cardiac center, your survival odds drop significantly. If your insurance requires pre-authorization before the ambulance can take you to the nearest hospital with a cath lab, you might die waiting for approval. If you're poor, Black, Hispanic, or female, studies show you're more likely to experience delays in treatment even after you arrive at the ER. The system's designed to save lives, but it's also full of cracks that people fall through every single day. Dave makes it through the procedure. The stent's in place, blood flow's restored, but as he's wheeled into the ICU, he's not thinking about how lucky he is. He's thinking about the crushing chest pain that's finally starting to fade, and wondering what the hell just happened to his life. Because congratulations, Dave beat the first 24 hours. Now comes the part nobody tells you about. Hour 25. Dave's alive. He's in the ICU, hooked up to a dozen monitors, with IV lines running medication into his veins. The procedure worked. Blood flow's restored. He made it. But his heart is still a ticking time bomb. Because the next 24 to 48 hours after a heart attack are what doctors call the critical complication window. Dave's heart muscle is damaged, inflamed, and electrically unstable. Anything could go wrong at any moment. First threat, arrhythmias. Dave's heart rhythm is being monitored constantly because damaged heart tissue doesn't conduct electrical signals properly. Random areas of dead or dying cells can create abnormal electrical pathways, triggering irregular heartbeats. Some are harmless. Some, like ventricular tachycardia or atrial fibrillation, need immediate treatment. And some, like the VFib we talked about earlier, will kill you in minutes. Studies show that about 90% of heart attack patients experience some form of arrhythmia in the first 48 hours. Most are minor, but you never know which one's going to spiral out of control. Then there's the risk of heart rupture, which peaks around day 3 to 5, but can happen any time in the first week. The dead heart tissue starts to break down as the body clears away the damaged cells. During this process, the wall gets thin and weak. If it tears, blood pours into the pericardium, the sac surrounding the heart. Pressure builds. The heart can't expand to fill with blood. You collapse and die unless surgeons open your chest immediately. It's rare, happening in only 1 to 2% of cases. But when it's your heart, 1 to 2% doesn't feel so rare. Another fun complication, itis. This is inflammation of that same pericardial sac. And it causes severe chest pain that can feel exactly like another heart attack. Patients panic, doctors run more tests, and everyone's on edge. It usually resolves with anti-inflammatory medications, but the pain is brutal and the fear is worse. But here's the complication that terrifies doctors the most: blood clots forming in the damaged heart chambers. When part of the heart wall isn't contracting properly because it's dead, blood can pool in that area and clot. Those clots can then break free and travel through the bloodstream. If one goes to the brain, you have a stroke. If it goes to the lungs, you get a pulmonary embolism. Either way, you're in serious trouble. To prevent this, Dave's now on blood thinners. Aspirin, clopidogrel, and possibly warfarin, or one of the newer anticoagulants. These drugs reduce clotting, but they also mean any cut or internal bleed becomes dangerous. Fall and hit your head? You could develop a brain bleed. Ulcer in your stomach? It could hemorrhage. It's a constant balancing act between preventing clots and not bleeding out. And then there's the psychological crash that nobody talks about. Dave's lying in a hospital bed, unable to move much, processing the fact that his body just tried to kill him. Post-traumatic stress disorder affects about 12 to 15% of heart attack survivors. Depression hits 30 to 40%. Anxiety becomes a constant companion because every little chest twinge makes you wonder if it's happening again. One survivor later said it felt like living with a loaded gun pointed at your chest, never knowing when it might go off. Dave's also starting a medication regimen that would intimidate a pharmacist. Beta blockers to reduce heart workload, ACE inhibitors to lower blood pressure and protect the heart, statins to control cholesterol, antiplatelet drugs to prevent clots, maybe a diuretic if he's retaining fluid. Each medication has side effects: fatigue, dizziness, muscle pain, digestive issues. Some guys develop erectile dysfunction from the beta blockers, which is just adding insult to injury. But the alternative to taking these medications is dying, so there's not much room for complaint. By hour 48, Dave's stable enough that the doctors are cautiously optimistic. No major complications, no secondary heart attacks, no rhythm problems that couldn't be managed. He's going to make it through the critical window. But here's the thing nobody wants to tell Dave. He survived, sure, but the heart he had 2 days ago? That heart's gone. And the life he had before? That's gone too. Congratulations, Dave. You're in the 70% who made it. You beat the odds, survived the complications, and you're going home in a few days. But that heart you had? It's gone. Because here's what permanent heart damage actually means. That dead tissue in Dave's heart, the section that died during the hour he waited, has been replaced by scar tissue. Scar tissue doesn't contract. It doesn't help pump blood. It just sits there, a useless patch in what used to be a working muscle. A healthy heart has an ejection fraction, a measure of how much blood gets pumped out with each beat, between 55 and 70%. Dave's ejection fraction after his heart attack? Around 40%. That's a 30% reduction in his heart's pumping capacity. Forever. What does that mean in practical terms? Dave gets winded walking up a flight of stairs. He can't lift anything heavier than 20 pounds without his chest tightening. He's exhausted by 3 p.m. every day. His doctors tell him no strenuous exercise, which sounds fine until you realize strenuous now includes things like mowing the lawn or playing with his kids. And the medications? He's on them for life. Beta blockers, ACE inhibitors, statins, blood thinners. The monthly cost runs between $500 and $2,000, depending on his insurance coverage. And that's assuming his insurance doesn't drop him or jack up his premiums, which happens more often than you'd think. Medical bankruptcy affects about 530,000 families every year in the U.S. Heart disease is one of the top causes, because it's not just the emergency treatment that costs money. It's the follow-up appointments, the cardiac rehab, the medications, the lifestyle changes, the lost work, productivity. Dave's going to miss at least 6 to 8 weeks of work for recovery. If he's lucky, his job has disability coverage. If he's not, he's burning through savings or going into debt. Some people lose their jobs entirely because they can't perform the physical tasks anymore. Then there's the psychological toll. Dave now lives with the constant fear of it happening again, and that fear isn't irrational. About 20% of heart attack survivors have another heart attack within 5 years. 1 in 5. Those aren't comforting odds. Every chest pain, every moment of shortness of breath, every time his heart skips a beat, Dave wonders if this is it. Is this the one that kills him? Anxiety disorders affect 30 to 40% of heart attack survivors. PTSD rates are around 12%. Depression is nearly universal. His relationship with his wife changes too. She's scared of losing him. He feels guilty for putting her through this. Intimacy becomes complicated because he's worried about triggering another episode, and the beta blockers aren't helping with that department anyway. Studies show that marital strain increases significantly after one partner has a heart attack, with divorce rates higher than the general population. And the lifestyle changes are no joke. Dave's doctor hands him a pamphlet about the Mediterranean diet, tells him to exercise 30 minutes a day, manage his stress, lose 30 pounds, and quit his high-pressure job if possible. Oh, and by the way, 50 to 70% of heart attack survivors don't maintain these lifestyle changes long-term. Old habits die hard, especially when you're depressed, exhausted, and financially stressed. The cruel irony? Dave now has to work harder to stay alive, but his body can't work as hard as it used to. It's like being told to run a marathon after someone cut off your legs at the knee. But here's the most frustrating part of all. Despite all of this, despite the death toll, despite the devastation, despite the shattered lives, most people still ignore the warning signs. You'd think after reading all this, people would pay attention to chest pain, right? You'd think they'd call 911 at the first sign of trouble. They don't. Studies show that even heart attack survivors who know exactly what symptoms to watch for often ignore them when they happen a second time. They convince themselves it's something else. They wait, they hesitate. And about 20% of them have a second heart attack within 5 years, often because they repeated the same deadly mistakes. Why? Because humans are wired to avoid scary truths. It's easier to believe it's heartburn than to face the possibility you're dying. It's easier to tough it out than to look weak or paranoid. It's easier to worry about the ambulance bill than to accept that your life is worth the cost. Cultural factors make it worse. Men are taught to be stoic, to push through pain, to never show weakness, so they suffer in silence until they collapse. Women are socialized to put everyone else first, so they downplay their symptoms and avoid making a fuss. Minorities face medical mistrust, rooted in historical abuse and ongoing discrimination, so they delay seeking care until it's too late. And the healthcare system? It's designed for profit, not prevention. Insurance companies would rather pay for expensive emergency interventions than fund the preventive care that might stop heart attacks before they happen. Hospitals prioritize patients based on perceived urgency, which means if you don't look like you're dying, you wait. And if you're Black, Hispanic, or female, research shows you wait even longer. Then, there's the deadliest type of heart attack most people have never heard of, the widowmaker. This happens when the left anterior descending artery, the main blood vessel feeding the front of your heart, gets completely blocked. It's called the widowmaker because if it happens outside a hospital, only about 12% survive. 12%. And even if you make it to the ER, your odds aren't great. There are warning signs weeks before a major heart attack that most people ignore. Extreme fatigue that won't go away. Feeling like you have the flu, but you're not sick. Indigestion that keeps coming back. Shortness of breath doing normal activities. Your body's trying to tell you something's wrong, but you're too busy to listen. And yeah, prevention basics exist. Mediterranean diet, 150 minutes of exercise per week, blood pressure control, cholesterol management, stress reduction, not smoking. Doctors throw this advice around like it's simple. But when you're working 2 jobs, raising kids, dealing with chronic stress, and living paycheck to paycheck. Just eat better, and exercise feels like a cruel joke. The system's broken, the culture's broken, and bodies keep breaking. Dave later said the worst part wasn't the pain, or the fear, or even the permanent damage, it was the guilt. Guilt for not acting sooner, guilt for putting his family through hell, guilt for ignoring the warnings his body had been sending for months. But here's the brutal truth. Until it happens to you, until you're the one clutching your chest in a parking lot wondering if you're about to die, it's just a scary story. Something that happens to other people. Something you'll worry about later. And for 18 million people every year, later never comes. So pay attention to your body. Know the symptoms. Don't wait. Don't rationalize. Don't convince yourself it's nothing. Because the difference between life and death is measured in minutes, and those minutes are ticking away right now. But if you thought heart attacks were terrifying, wait until you hear about strokes. They're faster, harder to spot, and just as deadly. The first 3 hours are everything, and most people waste them. Click this video right here, because this one's over. And trust me, it only gets worse.